what's really causing your outside elbow pain? Is it really tennis elbow? Today's video will discuss a differential diagnosis for outer elbow pain. Just because you have pain on the outer elbow does not mean that it's tennis elbow, or what we call specifically epicondylalgia, pain on the lateral epicondyle or outer part of the humerus bone. In our clinic and practice, we rule out the cervical spine first through cervical range of motion testing, particularly in the non-traumatic patient. We look at the history and their complaints and the past medical history to see if there's anything referring from the neck down to the elbow. Next is we have to consider the shoulder. Some of the rotator cuff muscles, like the supraspinatus and the infraspinatus, can indeed refer pain to the outer elbow. And thus, again, we have to rule out the shoulder before we rule in the elbow. Not to mention, any shoulder restrictions will lead to more stress and strain down into the elbow. Next is different muscles across or by the elbow that or live close to the elbow. For example, brachioradialis, this muscle that helps flex the elbow and ulnarly deviate the wrist, is called the brachioradialis. If you press and hold in that muscle and it causes your elbow pain, you now know it's not tennis elbow, and instead is pain from brachioradialis. This could be from a trigger point or from the muscle itself. Next is just inside or outside the brachioradialis is a little muscle called the supinator. The supinator helps, along with the biceps, rotate the palm up. And thus, the supinator can indeed cause outer elbow pain. Be very specific with your palpation of the epicondyle versus down a little bit lower to palpate the supinator muscle. To be sure that you're on it, you can take your palm up, and as you rotate your palm up, you'll feel that muscle contract or become taut under your finger and or thumb. If that causes the outer forearm pain, we now know it's not tennis elbow. It could be supinator muscle itself. It could be a condition called supinator syndrome. It could also be called radial tunnel syndrome. So as you're learning in this video, there's multiple causes or potential causes of outer elbow pain. And we're not done yet. There's two muscles that live on the side of the elbow that come down to your wrist, ECRB and ECRL. ECRB is the ant muscle, extensor carpi radialis brevis. It can withhold up to 10 times your body weight before it tears. And its bigger brother, the longest, extensor carpi radialis brevis, lives right next to it. To find if I have pain in those muscles, I pull the wrist up and in and resist down and away. If I feel pain not right on the bone where the tendon is, but a little bit lower, I'm starting to think that this could potentially be pain from these two muscles. So again, ECRB and ECRL. If I press here and hold and it causes the outer elbow pain, we now know we have muscular pain referring to side of elbow as opposed to true tendinopathy or tendon involvement causing tennis elbow or lateral epicondylalgia. This video is designed to be a differential medical screening diagnosis video. And this is Dr. J with the Human Movement Institute, where we have improvement through movement.